the first Monday after Christmas, and I am, I don't know, excited to be here today. It has been a fantastic morning for me already, and if you are a mom of four, you know how mornings can be a struggle. So, I just wanted to say it's been a fantastic day today, and I'm excited to be here to share a topic today. So, today I'm going to be comparing or giving some differences between an OBGYN, like your standard care for pregnancy and childbirth, versus a midwife and what midwife care would look like. So, let's get started. So, first of all, with an OBGYN, you are a patient. You are a number on a chart, and likely they will not remember you from one appointment to the next unless there is something like specific or I don't even know the word, but unless there's something that stands out about your particular situation, your doctor probably wouldn't recognize you on the street. And that to me is a problem. For a midwife, however, you are a client. You interview midwives. You see who fits your needs and your what the outcome is that you want. Like you connect with somebody on a personal level. You are a client, you pay them, and your appointments with them will be much different than your 5 to 10 minute walk in, walk out appointment with your OBGYN. And that's because there's a relationship being birthed, being created, grown in that space of your care because they want to know you. They want to know things about you because that helps them in the end when they are helping you in labor and bringing your baby into the world. So there's that one. Another way that you can tell the difference between a midwife or another difference between a midwife and a regular OBGYN care is that an OBGYN is taught that pregnancy and childbirth is something that is needs medical attention, that it needs to be controlled, it needs to be monitored, it needs to they need to be hands on throughout. And in most cases midwives are quite the opposite, and uh, they believe in your body, they believe in the birth process, and they mostly believe in hands-off approach. And there is somewhere where at some point I will talk about the difference between a midwife and a medwife. And a midwife is more medically minded. So they follow more closely to the medical stuff that your OBGYN would follow. So it might not be the right fit for you if that is what you're coming across. So just keep that in mind. There is a difference between a midwife and somebody. There are midwives who follow very closely to the medical guidelines, and those in the birth works arena call them midwives because they do follow those protocols, which limits them in how they can be flexible with you in your care. So the next one is your doctor is checking off all the boxes that they can to submit to insurance, to submit to just to charge more, right? But they're also there to like get more out of it, which is a more hands-on approach. There's a lot of stuff that you could say no to, but they make it seem like you can't. And so that is something that you want to pay attention to as well. One thing that I do is I help people learn what they can say no to so that they can advocate for themselves and navigate their care the way that they want to be cared for in those instances. And on the other hand, your midwife is governed by licensing and follows the government regulations according to the laws in their state and their certifications or their licensing. So They do follow that. However, they have midwives who fully believe in the power of a woman's body and the process of birth are more lenient, more willing to be flexible with you in your care. They're not like they're going to say these are the next steps. What do you want to do? You'll have those kinds of conversations with them in most cases, and not so much with your OBGYN. You won't have that. Here's what we usually do. What would you like to do? You won't have those kinds of conversations with most OBGYNs today. They are not taught to um, actually teach you that you have an option in your care. And the last thing I want to say is that, so I already said this about OBGYNs are that view birth, view pregnancy and childbirth as like needing to be medically contained, medically controlled. And that is so not the case. But in doing that, they they also treat birth as a medical emergency, which birth is not a medical emergency at all. If you look around you, I'm sure you've seen an animal sometime throughout your life have kittens, puppies, whatever. You've seen it at the zoo, whatever. You've seen somebody, some animal have uh, a baby, and they're not concerned. There's not these other cats who come around. In fact, other cats will leave the cat alone, right? Like it's like instinct of nature to want to be alone in those instances. So, uh, birth is not a medical emergency, but your OBGYN is a highly trained surgeon at C-sections, right? That's what they are highly trained in. They're not highly trained in physiological birth and the actual like birth process, the natural birth process. They are not highly educated in that, like just standing back and watching it unfold the way it was meant to be. So that is the one thing, like that is a huge aspect to think about when you are in labor. Is your doctor even knowledgeable of what's going on? Maybe knowledgeable on some level, but like understanding and just being willing, like not like panicking inside, not having anxiety over what's going on because they know that it's a natural course, right? So with the midwife, the one thing I will say is that they do believe in physiological birth in most instances and most midwives. However, there are midwives who will get handsy, which is like touching, doing things that we wouldn't necessarily want done to us um, during our pregnancy and inviting or welcoming our baby into the world. So the other thing to keep in mind is that with midwives, if they are following the guidelines and the protocols closely, some of them will have risk out limits. And so they have like these guidelines of, okay, well, if this happens, then you risk out with me. And what that means is that then you would have to transfer care to a hospital, to an OBGYN, to elsewhere. So if you had gestational diabetes and it was uncontrolled and they felt uncomfortable with it, they could risk you out with them and have you transfer to a OBGYN. So my name is Amanda, and I hope you enjoyed my topic today. I hope you got some information out of this that would help you in making decisions involving your pregnancy and childbirth experience. And if you are watching in my group, thank you so much for being there. I am in the group. You can find me at Open-Minded and Empowered Birthing Mamas. The address is right here on the screen. You are more than welcome to join there if this is information that you find interesting and valuable to you. We would love to have you there. I'll talk